So, welcome to this episode of Menopause Conversations. We're here to explore all the facets of menopause and midlife and how they intersect. And I couldn't be happier to be doing that with a returning guest, Dr. Vikram Talaulikar. Hello, Vikram. How are you?
Hello, Amantha. Thank you for inviting again. I'm good and hope you're doing well.
Yeah, I'm really good, thank you. And it's always a pleasure to see you. We're going to be talking today about something that it might interest you because obviously Vikram, let me tell you a little bit about Vikram. Vikram is a specialist in reproductive medicine at University College London Hospitals. He's also an Honorary Associate Professor in Women's Health at UCL, and he is very widely respected, let me tell you, for his expertise in everything that he does, particularly his menopause care, and his work spans patient care, research, teaching, making him a leading voice, much sought after. And he's also part of the amazing trio involved in the Menopause Research and Education Fund. That is a charity. We'll be putting a link to that so that you can actually donate to that because we need more research in this field. But we're here to talk about lifestyle medicine, and we're going to do that between us because lifestyle medicine is basically about using everyday choices. It's like how we eat, how we move, how we sleep, how we connect with others. Not only that, but it's also about how that intersects with menopause as well to protect our long-term health. So I just knew that Vikram would be the best person to have on to talk about this. So Vikram, would you mind actually just helping people understand a little bit more about lifestyle medicine? If we just define it for people, there are six key areas, and you might be able to help impart how you see this in your clinic. But number one is nutrition. Number two is physical activity. Three is stress management. Four is sleep. Five is substance moderation, and what we mean by that is smoking and alcohol, and relationships and social connection. So some people might be a bit confused, think, hang on a minute, this is a very experienced medical professional sat here in front of us. Why are we talking about lifestyle medicine? Why is that an important part of your work?
I think that it's probably the most crucial part of long-term health management. And it's great to see that organizations are actually defining lifestyle medicine or lifestyle interventions as a theme for the World Menopause Day or Menopause Year as it is for this year.
Yes.
It's been a neglected area. When people talk about menopause, people talk about hot flashes and HRT, hormone replacement therapy. That immediately comes to mind as a solution for menopause. And there is, of course, so much about it on social media or print media. But people don't often talk about the subtle things, the lifestyle interventions, the non-HRT interventions, which according to me, and I'm sure you'll agree and many others will agree, are actually more important than medical interventions such as HRT or other pharmaceutical interventions. So as you rightly said, Amantha, I think you keep stressing on this on the number of podcasts you've done already. But I think it's the six pillars, and we'll go through them one by one. So let's start one by one and prompt me as we come to the next one.
Yeah, of
But the
course.
lifestyle medicine component simply means this year's focus will be on everything you do about lifestyle to make your journey through menopause better, to protect your long-term health, and to improve your quality of life.
Agreed, because as a postmenopausal person myself, this is really coming into crystal focus for me because I'm noticing things now that I've been through the menopause. I'm feeling things. So what I would say is for everybody, please also do think about the postmenopause years as well. We get very consumed with the perimenopause and go, hurrah, I'm through. It's now the postmenopause. But actually we still need to keep doing the work. So you're right. So let's get into it then. And you're absolutely right. This is a theme for this year and every year, but it's just been identified as such. So let's talk about the nutrition, and maybe we could do physical activity together because they sort of go hand in hand, don't they? So talk to us a little bit about that and how that can help, particularly with maybe symptoms of the menopause.
So many women ask when they come to clinic, what should I be eating during transition, perimenopause, after menopause? Is there a particular diet you would recommend? Is there something more healthy as compared to something else? They
Yeah.
also ask about any particular form of exercise or physical activity I should be doing. Now, I'm not a lifestyle medicine expert. I'm not a dietitian, nutritionist. I'm not an exercise coach. So again, I'm not trying to step on anybody's feet, but
No.
all I can say is my advice in clinic would be just follow simple and most effective common sort of interventions that won't harm you. So when it comes to diet, and that's important because remember in menopause, your hormones are going down. You have the estrogen going down, you have the progesterone going away, you have the slow decline in testosterone. All those are going to slow down your metabolism. Your insulin won't be as effective as before. And with aging, all those sort of effects of lack of hormones are exacerbated. So what you want to make sure is the same advice one would give to prevent diabetes, to prevent high cholesterol. So when you're eating small portions and frequent meals throughout the day, rather than using, say, 2 or 3 big meals, because that would give a stress to your body, that would make it difficult for the body to kind of control the sugars throughout the day in your bloodstream. So small portions, and often we say Mediterranean type of eating or diet. Now you might ask me, what's the evidence? So people have looked at different diets during perimenopause, menopause, and there are conflicting data. There is hundreds of data out there on the internet saying one diet is better than the other. If you look at, filter out the evidence and come to what's the most effective, it does show that the most likely diet which is going to be helping you is the Mediterranean. So pulses, beans, legumes, oily fish, things like cereals, nuts, seeds, all those sort of things we talk about. Those are the ones that are going to be relatively healthier as compared to other. But that doesn't mean you eliminate everything else you're eating. The diet that actually suits you and you can fit into your day-to-day life, that's the key. It's not about just focusing on one thing and taking everything out, and then it becomes difficult to follow and you're back to square one. It is just cutting out some of the relatively unhealthy things, making small changes. So you're trying to get that diet towards the Mediterranean type. Few other bits, vitamin D, because you're going to need your bone health
Yeah.
to be kind of boosted. Again, with lack of estrogen, you're going to lose your bone density. So you want good amounts of vitamin D. If you're a person who goes out a lot, gets a lot of sun, if you holiday frequently, you might get enough. But for most of us in the UK, often vitamin D is deficient. And so you might want to supplement yourself with 1,000 to 2,000 units. If you have certain medical conditions, you might need to actually take more supplement. You may be poor absorber of vitamin D, then you might
Mm.
have to combine it with something else or take a bigger dose. Calcium comes through food. Again, your bones need calcium. So make sure you're having either dairy or non-dairy forms of calcium, whichever you prefer, you avoid. And make sure you have plenty of it, because if you can't take calcium through diet, you'll have to supplement for your bones.
Yeah, can I just say on that actually, I'm one
Yes.
of those people. I mean, even though I'm half Sri Lankan, for some reason I've got a higher demand for vitamin D. And so I actually take it as a spray with K2 under my tongue. So 3 sprays, so that you're absolutely right. It's about understanding what your personal
Yes.
need is for these elements. So I think that's a really good point, mate. I would also
And
say
don't
as
forget
well,
the protein.
well, thank you. Yes, what do we know about the protein then?
So with vitamin D, calcium, remember the protein because you're going to need it for your losing muscle mass, your bone
Yes.
density again. You need proteins. And as long as you're having good source of proteins, whether it's fish, whether it's meat, whether it's some of the vegetarian proteins, remember not to exclude them, not to forget them.
That's so important. Yeah, because we lose about 3 to 6 pounds of muscle mass every decade. I mean, it's frightening, really and true and truly so. And then I think sometimes I think this is a misnomer for people that they go, oh, it's okay, I just go down the gym. No, no, if you're breaking down muscle, you need to repair that muscle. So we need to put some protein back, don't we? So you're right. Can you give any people any idea about how much protein, or is there a standard sort of thinking?
Again, if you go by the nutritionist, they will give you certain grams of protein. They will work it out based on your BMI, your current muscle mass, what is your energy expenditure, how much do you do in the gym, for example, how much replacement protein you will need for all the muscle activity you do. And everybody's sort of requirements will vary slightly. All I would
Sure.
say as a general rule when I talk in the clinic, I say make sure you take something protein rich, whether it's the animal protein you like or whether if you're avoiding animal protein, then take something that gives you that protein through either dairy. And if you're avoiding dairy, then all the green sources of protein. As long
Yeah.
as you're not skipping it completely and you're only concentrating on, say, carbs or oils, then that's not going to help.
No, I'll tell you my favourite breakfast. This might sound horrendous, but it's a really good protein breakfast. I love the proper Greek yogurt because that's got lots of protein in it, and I
Correct.
literally stir nut butter into that. So you can actually get pack quite a lot of protein in to breakfast, and there is a thinking around, getting as much protein in earlier in the day will ward off those snacking episodes that we know just aren't helpful to us.
Absolutely.
Maybe on that, could you just say to people what because you brilliantly just mentioned there that our insulin sensitivity does start to change and not
Mhm.
always in our favor. How might that show up for people then? How might they start noticing that?
So things like putting on weight, which is one of the common problems that happens around perimenopause, menopause. Often people complain of putting on weight around the middle of the body, truncal obesity. You might find that your readings, if you're having monitoring of your blood sugars, then show borderline diabetes. So you are more prone to have diabetes during this time because
Mm.
of aging, because of the lack of estrogen. And those are usually the signs where you're thinking, oh, my metabolism is certainly dropping. And then making sure you're physically active to counteract that, making sure you're adjusting your diet because your metabolism is slowing. Those two will be the key lifestyle interventions, besides anything else like HRT, which you will consider depending on the other symptoms.
Yeah, can I tell you, I'll share with you, I wore a glucose monitor just out of my own I'm a biomedical scientist. I'm always tinkering around with something. And so I put a glucose monitor on and because I just have struggled to shift like half a stone of weight, Vikram. So I thought, what is it, because I'm doing all the things I'm meant to be doing, but I found it fascinating. Two things that really impacted me, and I know we're going to talk about stress momentarily. But I found that movement straight after eating is really good for my insulin sensitivity. So within 90 minutes of starting eating, within 90 minutes, I need to walk. Because if I'm walking, then the glucose from my meal is being used up by the big muscle groups. And I
That's
could
interesting.
see it on a chart that my blood sugar was coming down. And the other thing, which I know we will talk about, is stress. Stress really tinkers around with your blood
It
glucose,
does.
doesn't it?
It does. It raises cortisol, which is not good for your blood sugar. And often people find that the blood sugars are highest when they're going through stress. Diabetics often find when they're under stress, their glucose levels often creep up despite the same dose of medications they
Yeah.
might be on.
It's really interesting. It's really interesting. So we move on to stress then, shall we? Let's talk
Yes,
about stress
but
and
make sure
sleep.
we're not definitely recommending glucose monitors for
We're
everybody.
not recommending glucose monitors because actually we don't need to because the advice is generally I just did that for my own and because it gave me a bit of information that I
Yes, it
wasn't
gives you
able to.
understanding of your
Yeah,
physiology, isn't it?
but if we hyperfixate on these things become a stress, or constantly watching your Apple Watch and
Right.
all of these things. So yeah, good advice. And I think we only have to look at other countries across the globe. Mediterranean culture is such that people go walking after dinner, don't they? They don't become sedentary like we do mostly. We become really sedentary. So I agree with you there. So let's talk about then stress and sleep challenges. You choose which one you want to go first with on the stress or the
I
sleep.
think they're both interrelated because
Yeah,
one impacts the other. If you're
sure.
stressed, you won't sleep, and if you're not sleeping, you'll be stressed. So I guess it's in a way it's about making sure you have a bit of a work-life balance,
Yes.
making sure that if there are stressors in your life, dealing with them. Because if you're under stress, it is not going to help your general health, but equally, it's not going to help the menopause symptoms. Patients
Yes.
who often have the worst symptoms tend to have some or other sources of stress in their life. So when you do consultations, you explore people's lives, people's workplace experiences. You often find that women who are having significant stress in their life or at their workplace tend to certainly have significant menopause symptoms more so than somebody who doesn't have a lot of stress. Now, of course, the research regarding this is very poor. People have
Yeah.
not linked to appropriately, and we have a long way to go before we figure out how one impacts the other. But you can see that usually the stress will be a centerpiece around which all the other menopause symptoms or problems with sleep, fatigue, brain fog will revolve. And that again brings to the sleep. So if you're not sleeping well, definitely it's going to have impact on your general health. Poor sleep is associated with adverse cardiac outcomes, problems with high blood pressure, adverse metabolic outcomes. But equally, for your day-to-day living, it's going to have a straight away knock-on impact on your next day. You're not concentrating, you're having brain fog, you're fatigued, you're tired, your confidence goes down. And if you're not sleeping for days or months in a good quality sleep for long enough, that's horrible. That's the worst symptom of menopause. I often say you can deal with everything else, but if you're not sleeping, that's the worst bit that you can have.
Yeah, I would agree. I would agree with that. And, this, what I call regular pattern of nighttime waking, the 2 to 3 a.m., then you can't get back to sleep, or the type of sleep I often was having, what I would call anxious sleeping, like, whirring mind, very busy mind, like this perpetual hamster wheel type dream that you just couldn't get off, and therefore you then get up. And I think, it's important to talk about the mental load that women are carrying. We might be caring for elderly relatives. I'm an empty nester now that my daughter's gone to university. We might be having financial struggles, relationship issues. These are maybe the things that we're not talking about, but
Right.
particularly in a work setting, and we've got our job to do as well. So there's a real load, I think, on people, and so you're right. I mean, what do you think? I mean, I know it's going to be different for everybody, but what is a good amount of sleep that we could be aiming for? What's an ideal?
I guess 7 to 8 hours, depending on what sort of job you do, how demanding your daytime is. 7 to 8 hours is generally considered as a good range of amount of time of sleep. But again, quality matters. You might sleep and you might be restless in the bed for 8 hours. That's not going to be counting as good quality sleep. And there
No.
are a few things you can do because you know that the sleep is linked to your declining hormones, besides all the stress that might be causing you to not have sleep. And the lack of hormones is exacerbating the anxiety, the palpitations, the sort of heightened anxiety that happens. So, HRT is one of the interventions out of all the interventions we talk about for improving sleep. And many women find hormone replacement therapy, giving estrogen back, giving progesterone back, often will help sleep massively. But of course, there are women who may not want to choose HRT, want to go down the lifestyle route, and that itself might be effective for many. In
Yeah.
which case, for example, making sure you have a good routine, you hit the bed at a time that you have decided, 10:30, maybe 10, maybe 11, depending on your day schedule. Making sure you have that 7 to 8 hours uninterrupted. We all talk about not having screens before, at least 45 minutes before. Switch off your mobile, put it on the charger, don't look at it in the bed. Making sure you have a pen and a paper next to the bed, that's something that's massively helpful for many
Yes.
women. They
Yes.
come and tell that since having that diary or having that pen and paper, if they get up at night and they're starting about next day's work, thinking about what's going to happen about certain project, you can pen down your thoughts there and say, okay, I've put it down on the paper. Let me go to bed now and look at it at 8 a.m. in the morning. It's a simple thing, but it might help you.
Yeah.
And then,
I
of course, the carry on.
Sorry, I was going to just say one of the things that I have found really helpful to me is magnesium cream on my legs. And because magnesium is like nature's tranquilizer, isn't it? It really helps promote sleep. For me, I do take Utrogestan at night, which is the progesterone part of my hormone replacement therapy. But to get a deep restorative sleep, I find putting that on my skin or a glass of milk, because we know there's plenty of magnesium in milk, or having Epsom bath salts in your bath. These things can also be helpful. But I think almost what's lovely about what you're saying is the ritual of sleep.
Yes,
Rather than just arriving and like, well, I'll just try and get 7.5 hours sleep. We need to be a bit more intentional about it, don't we?
absolutely. And then there are small things for cooling the room, a cooler
Mm,
temperature room. Some people suggest having a sort of lukewarm bath before sleep.
yes.
Some people suggest reading something very light that's not sort of heavy just before you go to bed, or even having a conversation about the day with somebody who is near to you. All those sort of small things will work for people. Again, magnesium works for many, and it's great it works for you, but not for everybody. So there are
No.
women who've tried magnesium and come and say it doesn't work. Others feel just like you, they've tried magnesium, and that was one thing that made a difference to their sleep.
Yes.
So we're
Yes.
all different, and you have to find out what really is the routine that works for you if you're going down the lifestyle route.
Yeah, and can I tell you that one other little thing, and manufacturers of products really need to wake up a little bit about this. We know that red spectrum light is less likely to wake you up from a deep sleep compared to white spectrum light, but goodness knows why. So many manufacturers of fans insist on putting these white LEDs. So I always advise, I worked with a guy called Nick Littlehales. He used to be the sleep coach for Manchester United, actually, football club. And he said one of the things that they, as you rightly said, advocated was cool room, but actually block out any artificial light where as much as you can. You know, that's why with babies we put blackout blinds, don't we? So to give them that pure darkness. And again, that is something I always put. I've got a fan in my room, but I put a sock over the display so I can't see the white light. And again, it's these little things. I think because we have this
Correct.
heightened sensitivity that as our hormones are declining and changing, it can be the small things that
Absolutely.
make the biggest difference. So yeah, and I would agree with you because one of the things is with the sleep, we go through cycles of sleep, don't we? So we need that deep restorative sleep. So like you say, if you're tossing and turning for 7.5 hours, that's not going to be doing you any good. So
No.
so then let's talk on to something I think just sort of shoehorns nicely with this, unfortunately. If we're not sleeping, then we start leaning on various stimulants and things to keep us awake the next day, don't we? So let's talk a little bit about substance moderation and risk reduction, particularly around things like tobacco, alcohol, vaping, or other things as well that people might be leaning into.
Well, I think, again, the rule here is that anything in moderation when it comes to alcohol. Alcohol has certain significant downsides to many health issues,
Yeah.
whether it's increasing the risk of cancers, excess alcohol linked to cardiovascular disease, high blood pressure. So I think in terms of alcohol, making sure that you follow the guidance, 1 or 2 units once or twice a week. It's not in excess. Of course, no smoking. That's really key because that's again linked to lots of adverse health outcomes, whether it's heart outcomes or whether it's cancers. Both tend to also exacerbate menopause symptoms. So for many women, excess alcohol or smoking can actually bring on symptoms. Caffeine, which one wouldn't strictly say is as substance abuse, but even excess caffeine can trigger symptoms. A coffee can cause a lot of hot flushes for many women, and so
Okay.
they've almost given up on it sometimes. So everybody again is different, but try to have coffee in moderation, alcohol in moderation, and no smoking. Those will be really, really important for your future health.
Yeah, because I don't know the exact number, but the half-life of caffeine is quite long, isn't it? Which is why really in our workplace sessions we say to people if you are going to have a coffee, have it with a meal. You know, so if you're going to have your coffee fully loaded, have it with breakfast because then
And, and not too late at night, because
and
again,
not
that's
too late.
another factor which is for the sleep.
Exactly, because eating as well late at night or drinking late at night, it just turns the system back on when in fact we're trying to get the system to wind down and go into sort of standby mode. So tell me a little bit about how alcohol impacts, if you know, if you're able to, about the osteoporosis. You know, what happens to our bones with
So both
alcohol?
alcohol and smoking are risk factors related to bone density loss.
Okay,
And both of them would be one of the risk factors that you often look at when you're deciding, is somebody at a risk of extra bone loss. So often we
okay.
say, do you need a bone scan when you go through perimenopause, menopause to assess your bones? And you will often find that many calculators will take this as a risk factor because it does have impact on the metrics of the bone, and it will make your mineral density lower. And so if you're having excess alcohol, you're a smoker, then in addition to any other risk factors, you would qualify for being at higher risk of bone loss, and you need either monitoring or you need some sort of medical intervention if you start losing your bone, become osteopenic, or get towards osteoporosis.
Yeah. And usually, I used to sell an osteoporosis product back in the day when I was in the pharmaceutical industry. But, it's those small falls, isn't it, where we get those little hairline fractures.
Yes.
We always tend to think, oh, it's going to be a big hip fall or break. And no, it's not actually. It's going to be some of these little minor fractures, a little tumble somewhere that's telling us the process has already started. So that's good advice. Do we know anything about vaping in terms of bones, or is it too early to even know any stuff about the impact of vaping
I
on
haven't
women's
looked at
health?
recent studies, whether specifically there are ones in relation to vaping and bone health, for example. I haven't come across, there might be a few new publications.
Okay, so
But the
that could
last
be,
time which we did, we looked at a general sort of review of vaping. The outcomes were more or less similar to smoking. So it would give you similar risks to smoking in terms of general health outcomes.
yeah. One thing I would just back in track a little bit on the alcohol thing is I come across a lot of women who say, oh my gosh, I just can't tolerate alcohol anymore. Like they come out in hives, sort of more allergy-like symptoms, because obviously the histamine and these sorts of things. I mean, um, it's worth us saying this right now that actually any reduction in alcohol is good, isn't it? As you know,
Correct.
as we're getting older, but just to link the two there, if you are feeling like you're getting an allergic response to alcohol, is telling you something.
It is. It is. That heightened sensitivity is something we've come to know recently. Perimenopausal, menopausal women having more incidence of eczema, new skin allergy, allergies to new sort of environmental allergens or products, the increase in mast cell activity, histamine, which is thought to be happening during this menopause process. We haven't really done good quality research to pinpoint what is it. Is it the lack of estrogen alone? Is it the progesterone changes that are happening? Is it just generally some other marker in the blood that's changing with the aging and menopause? And so also we don't have good strategies. For example, HRT doesn't always help. For some,
No,
HRT may help, others doesn't. In fact, HRT may worsen this histamine sensitivity for
that was
others.
me,
Yeah,
100%. It
yeah.
made me feel so ill, even at low doses.
Correct. And then again, things like alcohol or what other triggers can bring on this sensitivity. We need a lot of research on this until we figure out what can be the solution. Because right now it's antihistaminics, anti-mast cell products, but do they work for everybody? Yes, for some, but no for many.
Yeah,
So I
and
guess
it's and,
that's a
I, and
piece of research which needs to be done so that we know what to offer women if they're
Hallelujah. I'm cheering you on for that one because they call histamine intolerance the 100 symptom condition, and boy, it really is. And a lot of those symptoms do mimic perimenopause. So, as a patient, it's very difficult. I was sat with a respiratory consultant, and he said to me, he said, anecdotally, Amantha, he said, I see a lot of women in midlife presenting with an asthma or asthma-like symptoms. And so I think we do need to do a lot more of this work because not only does it feel like you're dealing with menopause, now you've got a respiratory or some allergy type situation going on as well. And it's a lot for people to walk around with, I think. And I suppose that leads us nicely then on to just the loneliness of it all, the disconnect. And before we were recording, you very kindly shared with me that this is something that you're seeing in your clinic. So again, we sort of see this triple effect. You're stressed out, you're not sleeping, you're leaning on substances, you're probably disconnecting from people because you just haven't got the bandwidth, the mental bandwidth. So let's talk about social connection and then that medical integration, shall we? So how, when we think about that final pillar about relationships and social connection, I don't think many of us link that to physical health. What can
no,
you
we
tell us
don't.
about that?
So just before we started, as you said, we were discussing a lot of women come into the clinic, and the one thing that they often bring up is that they are having to navigate this phase all on their own. They are not able to share their journey, whether it's their partner, whether it's their family, whether it's friends, whether it's colleagues, whether it's other people at large. There is a sense of bit of isolation as you navigate perimenopause, menopause, and on your own. I don't know I mean, of course, it will be different from individual to individual, and you can have very supportive colleagues, friends, and family. But equally, you have women where I think you're left to deal with on your own, because
Mm,
maybe people don't understand what you're going through. Similarly, many health professionals may not be aware of all the symptoms, may not be aware of the differences in cultural sort of symptomatology or when it happens and how women may explain their symptoms. So they may dismiss it, or they may not be able to understand symptoms and offer help. So whether it's your partner, whether it's somebody close to you, whether it is health professional, we have to be better at being able to identify women who are feeling like they're having to deal with this on their own and
mm.
provide support. That to me is really important, because if that woman is left on her own to deal with this and she's not getting enough support, I think it is very difficult then to follow the lifestyle that you aim to follow, to do everything right that you want to do, and then still carry on with all your day-to-day duties and care
Yes.
for others.
Yes, and that is it, isn't it? It's like we're carrying quite a big load already. You know, people talk about allostatic load, you know, I talk about lifetime sort of load of stress, all the things that we're carrying, the different hats we wear, like mothers, managers, you know, we seem to have a lot to do. And that's not taking anything away from men either, because men's hormones will fluctuate also during this midlife stage. But I think you're right. I see this quite a lot, Vikram, in my work, in workplaces, but with perhaps very senior women who really feel very protective of their position. You know, they may have had to fight very hard to get to where they are. You know, just to share, we don't always find that women are very supportive. But potentially, if women are older and maybe postmenopausal and have got through this, some do wonder what all the fuss is about. Okay. But we know that pressures are even greater in 2025 than they've ever been for women navigating this life stage. But how, in your opinion, because I think it's fascinating, because you are the exception, I would say, rather than the rule, how can we better prepare women for a time limited consultation with a GP who may not know, unfortunately, as much as you know? How can we best prepare women to get the most out of that?
And again, I think this is something you suggested just before we were thinking about the podcast today. Is I think that first consultation with somebody, whether it's the healthcare professional, your colleague, friend, family, coach, that 45 minutes or 1 hour where you can sit down and not just discuss the medical side of things, but how it impacts your life, work, and what happens in the next few years or until end of life. I think that consultation is key. At the moment, because of resource problems, because of time constraints, because of lack of education awareness, sometimes women go for that first help or first support consultation, and all they get is a quick review of symptoms, checklist, either antidepressant or HRT prescribed, and off you go. But there is not enough time, not enough resource there to sit down and work through what could be done in your work, in your life, with the lifestyle. And of course, then you have access to all the medical interventions, which you can do side by side. You mentioned the buffet approach. That's a really good way to say it. It's not that this is better than that and that is better than this. You should only do this or only do that. It is a combination. We're all in it. We're all in modern life where there are hundreds of stresses. So you can do something with your lifestyle. If we give time, dedicate to it. You can do something medically if you need it, if your symptoms suggest, your medical health suggests, there are plenty of intervention. But sometimes that gets missed. The lifestyle, the work, listening, understanding, validating symptom, that aspect gets lost. And I think we have to
Yeah.
keep beating the drum. We have to keep educating healthcare professionals, public health campaigns, let women know that they can go to somebody and discuss all this. If we can provide that, as you try to do, as many of us try to do, I think that does make a difference. It's the first 45 minutes or 60 minutes does make a big difference.
Yeah, I completely agree with that. And, you know, it would probably be a good time to say, you know, there's so much available on the internet, but let's talk about the really good quality stuff. I know there's stuff on the Menopause Research and Education Fund. Diane Dancebrink, who is part of the trio that I mentioned, you know, this is always on my desk, by the way, because I always mention it, you know, and what is wonderful here is there are a lot of symptoms that you can literally tick And if you need to, you can hand this to your medical professional and go, listen, I've done the hard work for you. And, let's be honest too, that if you're having discomfort in your vulva, genital urinary syndrome of menopause is real, you can mark on here where it feels uncomfortable. Those are the sorts of things we should be advocating. And
Yeah.
and I told you today that I had a medical appointment myself for my foot. And I took my husband, and my husband said, would you like me to come with you? And I'm like, yes, absolutely. And so he was really supportive. And thank goodness he was there, because I forgot to mention something. And so, actually having an ally, an advocate, someone who, like you say, knows how you're feeling, knows what's important to you, they can be that really sort of like prompter to go, oh, remember you wanted to say about X or Y, and I think it's about being vulnerable. We can all afford to be a bit more vulnerable about this too, because I think we get further, and you're going to get good quality in that 10-15 minutes. But we can also encourage people to ask for a longer appointment. You might not get it, but you can at least ask, say, it's going to take more than 5 minutes to talk to the doctor about what I've got to talk about.
Absolutely, absolutely. And I think the vital thing you mentioned there was the tracking. Make your homework before you go. Yes, hopefully you will get more time than 10 minutes. You'll kind of discuss lifestyle, work, life
Yes.
balance, and the HRT if needed. But actually, you can even make it easier for yourself and the doctor if you have tracked your symptoms. These are exactly the ones that bother me. These are the ones which are really difficult symptoms, and I've read about this. How can I help myself? If you give that summary, and I know you might say, is it my job to do it? But actually, it will help you, because one,
Yes.
you've read about it, you've researched about it, you know the pros and cons, and then you're already presenting it to your health professional, who can then really make choices quickly within the limited time constraint you have.
I love that. I always remember Dr. Nigat said that to me. She said to me once, never underestimate the job you're doing, Amantha. She said, because you make my job a lot easier. If an informed patient walks through the door, an informed patient, it's a contract, isn't it? You're doing this together. It's not like the doctor's doing it to you. The more you can come. When doctors ask the question, what do you want from the consultation? How best can we answer that, Vikram? Because so many people say to me, why is the doctor asking me what I want from it? I mean, what in the context of our conversation today, what sort of things could we start thinking about when the doctor says to us, what do you want from today's consultation?
I think that will become very easy if you've done the research. So I think sometimes that question comes through genuinely because they want really you to suggest what you already know. That's great, because they're asking you, out of the research you've done, what is it that you want? I can have a look at that, weigh it up for you, and give it to you. That's a
Right.
really good way. Now,
Okay.
sometimes that question comes out of ignorance. That's when it worries me. If
Okay.
if the person may not know what to give you,
Yeah.
you tell me, take
Yeah.
this and walk away.
Yeah.
I hope that doesn't happen.
No.
I'm probably exaggerating things. But in a way, if that question gets asked to you, use all the research you've done, use everything, think about all that you've read, whether it's social media, whether it's print media, whether you've done your own research. What were your concerns? What is it that you got there to see this health professional, and say to them, these are my main issues. I want you to look at 1, 2, 3, 4, 5 options which I know about or read about, also any which I haven't read about or know about. What would you recommend for me, and what are its benefits and risk? And that will probably take another 10 minutes, but you will get your answer.
Yeah. And so on that, because it is just sadly the case that it is. Not everyone is as educated and as forthright as you are about championing for women and women's health. I do hear very sad stories every week, Vikram, about people who are dismissed, culturally being dismissed around menopause and women's health generally. It saddens me greatly, but that is our reality. How can people push back? If you know that you are entitled and there are options that can help you, I can think of a couple myself, which I often say to people, but how can we challenge back positively and respectfully when we feel like, hang on a minute, I don't think I'm really being heard here?
I think it is better to be clear and say that. You don't have to be rude or you don't have to
No,
be aggressive. But
no.
actually, you can say, look, I have told you the problems. I don't think that solution will work for me. According to my own research or my own reading or perception, I think this is what is happening and this is what may benefit me. I've looked at the benefits and the drawbacks, and I feel I'm ready to consider this. I don't think any health professional will not listen to that sort of an argument. Sometimes the health professionals worry because they may think that you're exposing yourself to side effects or risk. And if you give them the confidence that you know about them, you've evaluated that benefit risk, and you're ready to prepare to have a trial to see whether the risks or side effects actually are not great and your benefits are really there, then often get to that trial stage first. You say, I can do this for next 3 to 4 months, and then let me come back to you, and then you can assess whether I should continue or not. But I would like to try it for the next 3 to 4 months. It might mean 2 appointments, trying to convince the person in front of you and have that detailed discussion. But I think you will get there. The worst scenario where you just don't get on with your health professional, ask for a second opinion. Say that
Yes.
I'm entitled to ask someone else. Please, can you refer me to a specialist clinic? Please, could I see somebody else who may have a different opinion? Again, you cannot be refused a second opinion. That's part and parcel of good medicine.
Yeah, and do you know what? That's always what I say when I speak about you. I say to people, listen, under the patient's charter, you are entitled to be referred to wherever you want to go if you're willing to pay for the cost of your travel. So you don't have to stay in your own county. If there is someone better somewhere else, go there. It's about you being assertive and you're about valuing yourself. I often say to women, this is a moment for courage, for bravery, for whatever you want to call it, but we need you to value you because you deserve to get the right support, whatever that looks like for you. So that's brilliant. So before we finish then, Vikram, sort of in summary, we've talked about the six things, about lifestyle, nutrition, physical activity, stress management, sleep, substance moderation, relationships, and social connection. If someone was sat watching this going, I need to do all of that, where would be the best place just to start? Like, if we take it really practically, what would you say out of all of those things might be the best place to start, or a strategy for someone to start?
Work on each day one at a time. You're not going to change everything in one go. So start keeping a list of things that you eat and see what can I eliminate, which might not be the most healthy thing for me, little by little. Start with just 5 or 10 minutes of exercise a day. Remember,
Yes.
if you're trying to go for one, go for the weight bearing, weightlifting, or things where you have to pull and push things for your bones, or strength training, resistance exercise. I'm not great expert in this. I'm just giving you the terms, and you can then Google and find out which will be the ones you can manage.
Yeah.
So a little bit, 5-10 minutes a day.
Yeah.
Try and walk, take a walk. That might be the starting point before you do formal exercise. Alcohol, again, next time you're there and you think this is extra, don't go for it. Keep to the minimum. Caffeine, maybe 2 3 coffees a day. No, I can't take any more. Don't fall for the temptation. And then smoking, of course, no. You have to make effort, work with your GP, work with other colleagues who might be supportive, give up smoking, and hit the bed without the screen at 10:30 or 11, whatever you prefer. Just make
Brilliant.
that rule. Tell everybody in the house, you're going to tell me to go to bed if I haven't done it by 10:30, 11, and snatch my mobile from me. That's it.
Yeah, I've heard you can get these little safes to put everyone's mobile phones can go in. Do you know the only problem with that in my house is I know some if I'm in charge of the key, I would lose it. We would all be stuck. But you're right, it has to start small. And one lovely little thing that someone said to me, and it made such a big difference, was maybe exercise is a term we can bring in later. Just move, start moving
Yeah,
more. And that to me was a game changer. It felt less pressurized than
very true.
exercise. And moving, even if it's after dinner, with somebody else, having someone who can keep you accountable. I think all of these things are great. But I love that mantra, start small and yeah, just be intentional about it. So Vikram, where can people find you? Because you are an NHS doctor,
They
aren't
can find
you?
me on the NHS at UCLH Hospital. That is the best place. I hope in a nice way that they don't have to find me at NHS UCLH in London, because I think they'll be listening to this from all over the UK or wherever they are. And I'm hoping they will have very good local physicians, GPs, and gynecologists who will be able to help. There's so much education going on right now, and so many wonderful GPs and gynecologists who are now well trained in menopause. So they won't have to see me. But otherwise, I'm based at UCLH, and I'm hoping that we can help as many people as possible on the
And
NHS.
you really have done, because you're very humble, but the work you're doing with the Menopause Research and Education Fund, you're training doctors every year. Doctors, you're doing such a great job of putting the right information back out into the spaces where we need to have it. But we
Thank
just
you.
got to keep going with that, because it's woefully inadequate still, but we need to catch up. But not to despair. If you're not happy with the care that you're getting, it is your right. Vikram and I have both made that really clear. You do have options and choices. So for now, I will say, um, we always appreciate people listening to this podcast, because even small sustainable changes can make a massive difference, whether that's one extra walk a week, whether it's parking in the furthest part in the car park and walking into the office, taking the stairs. Don't always take the escalator or the lift. Hopefully we've inspired you that there are small changes that can be had. So until next time, I'm Amantha King, a workplace menopause consultant, and I'd like to say thank you very, very much. After work hours, as committed as ever, Dr. Vikram Talaulikar, thank you so much for your time.
Thank you, Amantha. Thank you for having me. And as always, continue doing the good work in this space.
And you too. Thank you so much.